Since the outbreak of COVID-19 in Nigeria, the management of patients who are asymptomatic is perhaps one of the most difficult for the Nigeria Center for Disease Control. While such patients find it difficult to believe that they are carriers of the virus, health workers on their part do not know when it is safe to discharge such patients from the hospital. But a new case management by the NCDC may have laid this confusion to rest.
For symptomatic patients, they may now be discharged 10 days after symptom onset, at least 10 days after symptom onset, and at least 3 days without symptoms. If you're asymptomatic, we can discharge you. You can be discharged 14 days after your first PCR positive test. So we no longer have to wait for a negative test to discharge. You can be discharged 14 days after your first positive.
In his address, the chairman of the Presidential Task Force on COVID-19 highlights what it means for states to take more responsibility and to stop the spread of the virus in the second phase of the ease of lockdown.
I have said it often and often, and I will repeat it again. Health is on the concurrent legislative list. All the 3 tiers of government on a monthly basis from the Federation account, from the FAP meeting, collect the distributables and they ought to apply it to the entire segment over which they superintend. Secondary health system is the responsibility of the state. University teaching hospitals, federal medical centers are tertiary institutions and specialized hospitals that you have all over the country that are established by the federal government. So it's a shared responsibility. We will not hesitate to review as we progress, should the situation warrant, to avoid preventable risk of transmission.
The Minister of Health advised against the use of rapid test kits for COVID-19.
To comment on the various test kits that are thought to be in use in Nigeria, especially the antibody-based test kits, I would like to advise that only 4 of those kits have been evaluated by the Medical Laboratory Science Council of Nigeria, and all 4 of them failed the validation test. NCDC certified laboratory in Nigeria is still the WHO-recognized PCR testing method, which gives us reliable results.
Nigeria currently has well over 11,000 confirmed cases of COVID-19, just as many anticipate a further surge in cases, as states across the country continue to relax some of the restrictions imposed to check the spread of the virus.